Well, moving right along, we have a little education session. Some of us in forming this group, one of the things that we felt strongly about was providing some education opportunities for the families who were part. So I'd like to introduce Gretchen Carroll, who's here tonight to share a little bit about navigating school with a child with congenital heart disease. Welcome, Gretchen.
Thank you. Thanks everybody for having me. Margaret, are you going to do my forwarding of slides?
Yes, I can do that.
That's awesome. Okay, you can go to the next slide. So I appreciate you guys inviting me today. Because we have such a small amount of time, it may seem like I'm speaking rapidly, so I'll apologize in advance, but I want to make sure there's time for questions at the end. So the real challenge in terms of talking about this topic is that this is what we know. We know that research tells us that children with complex heart problems are at a greater risk for neurodevelopmental issues that affect their school performance. Next slide. And the difficulties can vary tremendously in terms of severity, but we know that these are the types of areas where we often see the greatest impact. Learning, cognitive abilities, fine motor skills, gross motor skills, speech and language development, attention, as well as behavior psychological issues such as depression or anxiety. Next slide. And the real primary challenge is there's almost always a time delay between the medical events and the educational impact. And then you add to that this lack of knowledge about the neurodevelopmental impact of CHD among educators. So you may have a kindergartner, 4th grader, 10th grader, and it's possible that the child's teacher or nurse may have an awareness that your child had open heart surgery when they were a baby. It's very likely that that teacher has really no knowledge that the difficulties your child may be having in school today have any relevance or connection to the cardiac issues that happened back in infancy. Next slide. So I try to take a really practical approach when I have these presentations. So I just want to give some tips and strategies about how you would navigate the process. So in terms of how you get help, if your child is currently receiving early intervention services in Ohio or Kentucky, it's Help Me Grow or First Steps, the agency should assist you with requesting a formal assessment through your public school district. Next slide. However, if your child is not receiving services currently, you can and should request an evaluation, and that can be done in a very simple way, and it can be done through really any grade from preschool all the way through the conclusion of high school. And what that document would look like would be, it can be a simple letter. It needs to be dated and signed. And in that, you would have a simple description of your child's CHD, and then a description of your concerns, which are essentially your rationale for evaluation. So for example, you could say, my child's been diagnosed with hypoplastic left heart, and as parents, we've had concerns for several years about speech and language development or acquisition of early academic skills. And so we are requesting a formal evaluation. And the reason it's important to put that in writing with a signature and a date is that literally starts kind of a legal clock ticking in which the school needs to respond. Next slide. So obviously what goes on in an evaluation is going to vary depending on the presenting complaint and the age, but this is a pretty comprehensive list of the most common components of evaluations to determine if a child qualifies for intervention. So if there are any learning concerns, it needs to have an educational evaluation. A psychological evaluation is also often done, and that would usually encompass an IQ test. There are assessments in speech and language. There can be assessments in occupational therapy if there are fine motor concerns, physical therapy if there are gross motor concerns. If there are any primary concerns in behavior, it could be attention, it could be anxiety, depression. You want to make sure that there are behavior questionnaires that both the teachers would fill out and the parents would fill out. A classroom observation is often a really important part of an evaluation. And schools tend to love to also do curriculum-based testing, which are those kind of normed testing that are done group administered, usually 3 times a year, where teachers are getting data about how your child is progressing in reading and writing. And that's another component that can be important in the evaluation. Next slide. So once an evaluation is done, there is a meeting, and it's kind of a ding ding, yes, you qualify for intervention, or sadly, you don't qualify for intervention. And I know many of you on the call have children who are on IEPs, but just for those of you who may have younger children or children who are not on any kind of plan, I do want to just briefly touch on the most common plans our kids can qualify for. So the kind of gold standard is the IEP, or the Individualized Educational Plan. And this is a formal, legally binding document that outlines special education and related services based on the identified needs of the student, which hopefully were identified very clearly in the evaluation we just talked about. And the special education services on an IEP are things like reading intervention or math intervention. The related services are components such as speech therapy, OT, or PT. And IEPs include goals and objectives. So a goal might be that your child will read 75 words per minute with 80% accuracy. And IEPs also include accommodations and modifications. And accommodations are things that will kind of change the environment. So common accommodations for my patient base are things like extended time or physical breaks for kids that have ADHD with hyperactivity. Modifications are actually when there are changes to the curriculum. They're most common for kids whose developmental needs are more significant. So a modification might be a second grade child, instead of doing 2-digit plus 2-digit addition and subtraction, will be doing 1-digit addition and subtraction. So it actually changes the content. Next slide. The second most common plan is a 504 plan that our kids fall under. This is fundamentally different than an IEP. It falls under an entirely different piece of legislation. And a 504 is much more designed to provide what we call equal access through accommodation to ensure a fair and level playing field. So unlike the IEP that is much more focused on specialized instruction and related services, and remember IEPs also have accommodations and modifications, a 504 tends to be more focused just on the accommodations or modifications and changes to the learning environment. Next slide. Now, the individualized health plan can be tricky, although many of our kids have one. What can be somewhat challenging is in some schools like to write the health plan as a related service on an IEP. Other schools will write it within a 504. Many schools, however, will write it as a standalone document, which I actually, in my personal opinion, prefer, because I think it's nice for there to be a single document that can be accessed by anybody in the building at any time that really has that defined health plan. And the health plan is developed with a school nurse with input from medical providers and guardians and parents. For patients that have more significant medical needs, children with trachs, for example, or complicated feeding issues, the health plan can include nursing services or an emergency plan. For certainly most of my patient load, the health plan is usually more focused on putting things into place that will lessen the spread of germs and maximize student health. So, for those of you on this call who may have younger children who haven't entered school, and perhaps you have a lot of anxiety about, is it safe? What about germs? We can put a lot of very functional, appropriate things on a health plan to ease some of those fears. So some of the most common elements that we'll write with teams might be things like restrictions in gym. For example, that a child should not participate in activities where there's a risk of kind of a chest compression, like dodgeball. We have elements on health plans for children not going out to recess when it's below a certain temperature or above a certain temperature. For some of our younger students, a lot of the components have more to do with germs. So we can ask that there's more wiping down of surfaces more frequently, or not sitting your child next to a child who looks potentially ill, like has green snot coming out of their nose. A common one is also that the parents are notified by text or call by either the nurse or the teacher if there's a lot of flu going around the classroom or strep throat or respiratory issues, so that you as parents can make a better decision about whether you want to send your child to school that day or that week. Next slide. Now, I want to really kind of hit on some of the most helpful strategies in kind of navigating this path. So The most important one is to share information about the risk for neurodevelopmental issues with CHD. Because as I said at the outset, many educators have no idea. It's not something that's incorporated in educator programs for teachers. So sharing that, and to be perfectly honest, that usually means a conversation about it every single year with your child's new team, and really reminding them that we know our kids are at higher risk, so we want to be vigilant and really watching the development of our kids more closely. Of equal importance is, as parents, understanding the rules of eligibility. So a diagnosis does not mandate the provision of services. I have many very intelligent, capable medical providers that I work with in my setting that still kind of are in this mindset that as long as your child has been diagnosed with a cardiac condition or perhaps diagnosed with ADHD, or maybe they had an outside evaluation and were diagnosed with dyslexia. I have some, well-meaning colleagues who will say to patient families, oh, your child has a diagnosis, your child will get an IEP, or your child will get a 504, when in fact there is a real hurdle sometimes in being eligible for services. And that hurdle is whatever the disability or impairment, we have to document how it substantially affects educational performance. So that can be a challenge, and it's helpful if we know that. So when we're explaining the concerns that we have, the struggles the kids are having, we can really push for and document the ways we see the diagnosis impacting educational performance. And I want to pause just and go over a question that I get frequently from parents, which is, well, what if my child, let's say they qualified for a 504 plan, but I really think they need an IEP, which one should I be pushing for? And the important answer to that question is, when you're looking at your child and their unique needs, asking yourself, does my child need a specialized service? Do they need a person who is providing specific help in reading? Do they need a speech and language therapist? Do they need occupational therapy? If they need specialized services, then the IEP is the plan that they need. If, however, their needs can be met adequately by accommodations and modifications and really don't seem to need specialized instruction, then a 504 can be perfectly and appropriate for the child. I will tell you, and for those of you who have children on IEPs, you will be aware of this. It's not uncommon, particularly for our patient population, to have schools try to steer you to the 504. The reality is that there's kind of two reasons. One is, I think schools see medical condition and think, oh, that's a better fit for a 504, because they're not aware of the neurodevelopmental impact of CHD. And also, to be very honest, a 504 is a much cheaper thing to implement if you're a school than an IEP, because it usually doesn't come with a person providing those services. So being aware of the differences and kind of how to think about it in terms of your particular child. I strongly advocate for parents to request that close monitoring of educational, social, and behavioral progress, and to ask for intervention when issues are noted. Back to that meeting where you would discuss after an evaluation has occurred if a child qualifies for services, whether it's an IEP or 504. There are instances, of course, where school teams may say, well, yes, we see some issues, but we don't think they're significant enough for eligibility for an IEP. You still have a right to ask for interventions. And most schools use kind of a tiered approach to interventions, where they will provide lower level interventions and then see how the child progresses, and only eventually get to the IEP if some of those lower level interventions have been tried but have not made a significant positive impact. So it's appropriate, even if you don't initially qualify for an IEP or 504, to still ask for interventions or accommodations if they're warranted. And then finally, it's very helpful if you have neurodevelopmental teams in your children's hospitals in your areas or regionally. We see patients at Cincinnati Children's from West Virginia and Indiana and Michigan. And because many of these clinics will see kids either every 6 months or every year, it even can be worth making a travel to a center to have access to specialists who are really working to acknowledge and address the neurodevelopmental issues of our kids. Next slide. And I want to end with the silver lining, and I feel this very passionately. I have been in hundreds and hundreds of school team meetings. I've been in special ed for decades in a clinical model. And I can tell you that educators are typically interested and responsive when they learn about the educational significance of CHD. There are many times in a meeting where I'm explaining the neurodevelopmental impact, and there's a lot of aha moments that, oh, I had no idea. And because in our culture, medical providers are still very highly esteemed and medical conditions are taken very seriously by educators, I find that once that impact is really shown to the school team, that schools can be very responsive and typically are. And then finally, as this call and your group, of course, shows very clearly, there is a strong network of families that exists that is able to provide guidance and support. And certainly, you know, in these parent groups, family groups, I think it's critical to be very open and helping those who are a little bit behind you. So if you've got elementary school aged kids, maybe you can partner with someone who's got a child entering preschool, or if you've got a middle schooler, you can help someone who's in upper elementary and so on. So you're really learning from parents who have really gone through the maze before you to help you pave your path as well. And I am going to stop. I think I was close to 10 minutes. It's hard to do this topic in 10 minutes, but I'm happy to take questions.
I think Missy had one in chat. Can you speak to the option of individual plans prior to preschool to address neurodevelopmental concerns in early childhood?
Can you repeat that, or maybe I can read it?
Yeah, I have my 2.5.
Oh, I got it. Okay.
So it might be good to read it.
Well, in my experience, I come into the team for our patient base right before they turn 3. So I know that I'm not familiar with any specific IEPs until they are age 3. Prior to that, it's really working with the early intervention teams, which vary depending on the state you're in, to come up with plans. And that's usually driven by those early intervention programs. In our center, we really begin the school piece at that 2.5 going into 3.
First of all, thank you so much. This was very, very interesting and kind of the moment, as personally, we're deciding on like preschools right now and visiting preschools. So when you say educators are typically interested and responsive when they learn about the significance of CHD, is that something that you suggest people just bring up to a teacher? Like even if you don't qualify for an IEP or a 504?
Absolutely.
Tell them straight up.
Yes. And okay. To talk about the heart condition and talk about what we know about the neurodevelopmental risk. And I should have said, and I'm sure all of you are aware of this, there are many patients and many kids with CHD that never need an IEP, never need a 504, are very typical in terms of their learning development. But it's also not uncommon for some of our patients to not have notable struggles until they're in middle school or sometimes even high school. So just having the teams be more aware and understanding that connection between the cardiac issues and potential for neurodevelopmental impact, it just makes teachers more mindful, and it essentially gives you more power in really asking for monitoring of your child's progress.
Awesome, thank you.
Gretchen, I have a quick one. What do you say to the parent who says, I don't want to stigmatize my child by giving them a 504 or an IEP right off the bat, or not advocating for that?
That is an occasional issue that comes up. My response to that is kind of twofold. First, I think parents are often kind of thinking back to maybe their own childhood where differences and having like an attention problem or a learning problem meant a little tiny room in the basement of the school. And today's schools are much more different in terms of kids coming in and out all the time. There's mental health people in the building. intervention is not nearly as stigmatizing as it has been in the past. Sometimes you can assuage some of the fears in that regard. And the second is we know that delaying intervention when intervention is needed can have really negative outcomes in terms of rate of progress. So to try to really sell the fact that if your child is presenting with difficulties and they do qualify for an IEP or a 504, the earlier you can get it, the greater chance we have of really lessening the impact of those issues over time. Often I find it's much more kind of a parent's fear than it is a legitimate concern in the actual world of the school.
Thanks for that.
I put a question in chat. Hopefully you can. Sorry, again, mice.
Oh, the resources, like the actual, like who would be paying for all of these? If it's a public school, so in public schools, they are required, if a child is determined to be eligible for an IEP or 504, those services have to be covered by the school. So that there's never a cost in a public school for those services identified in an IEP. Some private and parochial schools will also have speech and language pathology, which is free. For example, some have intervention specialists in the building, which are no cost. That just depends on how the private and parochial school has set up some of those outside systems. And sometimes the parochial and private schools actually partner with the public school. So you may have the speech and language pathologist in the parochial school actually coming and paid for by the district that school lies within.
Got it. Thank you.